Hi again, everyone. We're going to talk about devices today. And you might wonder what the devices are or what we'd even be talking about as a role in heart failure. There are a few different ones we can talk about, but I want to just sort of give you a little bit of an overview, not too much depth, but just so you have a bit of an understanding and so that you know maybe what to ask about in your case and advocate for. For those of you who haven't joined me before, I'm Jodie Ann Senior. I am a heart failure specialist and cardiologist. I work in Australia, at least at the moment. First of all, I want to touch on the things that you might actually be already familiar with and interested in and tell you how they might help. For example, you might have wearables. Wearables might be something like an iWatch. They can track things like your oxygen saturation, your heart rate, your zone training, although I haven't worked out how to get mine yet. Oops, still figuring that one out. Anyway, there are lots of wearables that could be of interest. You may even have devices that aren't wearable but are portable, so you might have an oxygen saturation monitor at home, and these became more popular during COVID for good reason. You might have blood pressure monitors, you might have heart rate monitors. There are even cooler devices coming out, which we'll talk about in a bit. But if we just stick with, the wearables for the minute, these things, you've just got to remember that these things are guides because they are estimating things like oxygen saturation and heart rate, not actually utilising proper 12-lead ECG, for example, then they aren't definitive in diagnosing things, but they can be very helpful, especially if you're wanting to track certain things and you know that your device is tracking fairly well. So, for example, if you have an irregular heartbeat or atrial fibrillation, then you're not in it all the time, but you go in it from time to time and you aren't as well when you're in it, then something like an iWatch or some other device, even a live core, which is like a little portable device that you just put your thumbs on and then it can record an ECG strip of that. Those things can be quite helpful. Again, they're not perfectly diagnostic and you probably need to run that information past your doctors or cardiologists, but they can be really good at possible alert in terms of picking up things that are wrong. For example, I have a patient who has a Garmin, which he wears, and he has a PT to help him do some training, and he knows that his heart rates generally sit in a certain range. There might be like 60s up to 80, 90, and even when he trains, he might get up to 110, but you see it drops back nicely. What you can look out for example, is if you're just sitting doing nothing and then suddenly your heart rate jumps from the 60s up to 120, for example, then something's not quite right, especially if you aren't exerting yourself. So that could be that you have an arrhythmia and that needs to be followed up. If you see maybe you're sleeping and your heart rate sits in the 50s during sleep, and then you see these spikes overnight, it's possible it's artifact, but it's also possible that this is actually tracking your heart rate properly and you actually have a problem. So these are things you can look at and go, okay, this doesn't look quite right. That's not following my normal pattern. I need to maybe get this checked out. So wearables, biometric tracking, things like that, they can be useful as long as you take them with caution and also check with medical professionals about the validity of what's happening. I will get patients, for example, who come to me for a stress test and they've noted, high heart rates during exercise on their heart rate monitor or Fitbit. That we can then test out properly with proper 12-lead ECGs and an exercise stress testing machine. and see whether or not the patient's actually having an arrhythmia during stress, or is it that the device is just picking up artifact or noise, and that's causing the high readings, and that's possible. So this can be quite a good way to evaluate that further. So what other things are on the horizon? There are companies that are working on devices that could detect heart failure or monitor heart failure or valvular heart disease or arrhythmia. And those things will be portable, some of them will be wearable, and there are quite a number of companies that are investigating the use of these things to further help diagnosis or monitoring in heart disease. But let's get on to some important devices in heart failure specifically. One of these is a very important breakthrough that happened a few decades ago, and that's called a CRT pacemaker. The CRT pacemaker is basically a 3-lead pacemaker that each of those leads goes into a couple of different chambers in the heart, and the CRT is basically resynchronization of the way that the heart contracts. So under certain conditions in heart failure, there will be gross distortion of the way that the heart muscle contracts and whether it goes left to right or right to left. And the changes that occur can really affect cardiac output, or how much the heart can pump blood around the body. And so these devices were trialed and discovered to improve the contractility, resynchronizing the heartbeat in a way that allowed the heart pump to be more effective. So these aren't for everyone with heart failure, but there are certain categories of patients that they actually are very beneficial for. So there are criteria in terms of what symptom level you have, how strong the heart pumps or doesn't, and whether or not you have what we call a conduction delay in the electrical activation of your heart, and that can be picked up just with an ECG. So in the right patients, CRT devices can be very effective. They can improve, in some patients they improve symptoms very, very quickly. We can see that either by patients just sort of reporting that they feel a lot better. We see it sometimes even that we put these devices in and then patients actually suddenly lose a lot of fluid that they were retaining and they automatically feel better with that. Other patients don't have an immediate response to this, but over time you see that the heart pump actually improves and that the ejection fraction, which we monitor the ability of the heart to pump, actually gets better. So these have been really incredible for the right kinds of patients. In some patients, they really aren't appropriate and they wouldn't really benefit. And because they are a pacemaker, this is still an invasive surgical procedure done in the cath lab. How is that done? Well, it's basically under your collarbone. They make an incision, probably about that wide, and then a pocket is created under the skin, and a smallish device is inserted into that. That's the generator, and then the leads are connected up and passed down into the heart, so that they can then activate the heart muscle correctly, and that's tested at the time. These devices are a little bigger, a little thicker and a little heavier than the standard 2-lead or 1-lead pacemaker, but they've over the years become much more refined, lighter, smaller, and I think they'll continue to do so. There is another important device that needs to be discussed. Some of you may have, some of you don't have, some of you might need or are being assessed for a cardiac defibrillator. That is an internal one. So these are not the ones that you see on TV where they put the paddles on the chest and you're in cardiac arrest and then they zap and the body sort of jumps and electrical shock is delivered to the heart and the patient, then hopefully recovers from the arrhythmia and wakes up. So what is this device? The defibrillator is basically built like a pacemaker, but it has the ability to deliver a charge to the heart itself. And again, this is done internally. So again, a little cut here, pocket-made device goes in there, lead goes down into the heart. That lead is delivered into the ventricle of the heart. And if the pacemaker, what it does is it tracks the heart rhythm. If it sees that it goes out of rhythm and causes either ventricular tachycardia or ventricular fibrillation, both of which can be very life-threatening, especially in heart failure patients, then what the device will do is it will probably first, depending on what's happening and the way it's set up, try and pace you out of that fast rhythm. But if that does not happen very quickly and it fails to do that, then it will next deliver you a shock after a short number of seconds. That shock is much, much lower voltage than anything that's delivered over the chest, because it doesn't need to go through all the tissue outside of the chest and reach the heart. It's delivered straight to the heart. So it's a much, much smaller electrical shock. Having said that, if you are not unconscious at the time that shock happens, then that can be quite a nasty experience, and that's one of the potential downsides. But usually your electrophysiologist or cardiologist that specialises in these devices will have set it up so that should you get one of these rhythms, generally what happens is if they're sustained, you'll pass out. And having passed out, it will then deliver the shock. You won't be aware of that, but you would then hopefully wake up. That gives you then an opportunity to raise an alert and get to hospital, seek medical advice, having been in that situation. And you may need monitoring, you may need the defibrillator to be interrogated and just to see what actually happened and what took place. So the defibrillator device is a potentially life-saving device. All these things are, invasive procedures. They are not completely without risk. They have a small risk attached to them, relatively small compared to the risk of perhaps not having one of these things if you actually need one and want one. And again, there are certain criteria that you would need to have applied to see if you warrant one of these devices. Historically, certainly severe cardiomyopathy with ejection fractions less than 35% were generally the ones that were offered this therapy. If you have a cardiomyopathy that is of unknown cause or idiopathic, then there is some evidence to show that these devices may not be as necessary in these cases. That's something to be discussed with your physicians. But there are cases, certainly if you've had some VT, where it could be applied as not a primary preventative, but a secondary prevention device. If you have ischemic cardiomyopathy, that is a heart failure that is caused by heart attack and loss of heart tissue and a low ejection fraction, then these devices may be very relevant to you. And it's less likely that you'll get recovery of your heart function, whereas some of the idiopathics may recover and not need the device. But the ischemics, for example, are more than likely to need the device if they're severe enough. And in those instances, you may well get one of these. So, if you think that's something that fits your situation potentially, or you just want to know more about that and see if it is relevant to you, please, I urge you to discuss that with your doctor. So, you might also want to know that they've got the batteries in the devices. I meant to say that. The battery life depends on how often and how much you use it. Certainly in a pacing device, you use it a lot, whereas the, and in fact the CRT, you're meant to use this all the time because it's recoordinating your heart, electricity and conduction. But in the case of a defibrillator, then you're hopefully never using that, but it's there like an insurance policy. So if you did need it, it's there to deliver that shock and save your life, hopefully. So you're not going to be using that one very much. And so the battery life for that one might be a lot longer, potentially, than the CRT device. But the average of these things, very much depends on how much the device is actually in use. And when your device is checked, which will be at least annually checked by the device implanter and the company that supplied that device, then they'll be able to tell you things like how long is my battery life. And then what happens when you need to change it. So that's easy enough. You have a small repeat procedure where they open up that pocket, take out the existing device, disconnect it, put a new one in, connect it to the leads, and then stitch it back up. And so that's a little simpler and shorter than the original procedure, but a procedure nonetheless. And hopefully that doesn't happen very often for you over your lifetime. And was there anything else I need to? Often there's questions about, if I have a pacemaker, can I have an MRI? Again, that depends on the device. The current devices are pretty clever and have been designed to be able to be utilised with MRI. They can still potentially heat up, so that's a factor that's considered. It depends on, if you've had a newly implanted device, you can't go in an MRI straight after a pacemaker implant because the leads aren't stable. So you'll have to wait a number of weeks before you're allowed to have one. But these days the devices are often MRI compatible. Again, you need to check the specifics with your device maker and your device implanter, but entirely possible. So I think that's probably enough on devices for the moment, but if you did have questions, please let me know and I'll try and answer them for you in the comments or do another video for you if that's if it requires a bit more explanation. Hopefully this information is helpful to you. We've got more in the roadmap to managing your heart failure optimally and getting you back to thriving and not just surviving. So please stay tuned. Make sure you've subscribed so you don't miss anything. And if you like this one, please also give me a thumbs up because that's going to help get this out to more people. If you have someone that also has heart failure, please share this video so that they can also get this information. And if you feel like there's things that you want to know about, please let me know so that I can guide my videos towards the things that you actually want to get clear on and need help with. Okay, see you next time.